Menopause. Natural solutions. Different phases and the symptoms related with each phase. Production of themedicalvalley.com. Let's take a look at the various stages of menopause and the symptoms associated with each stage. Premature menopause. Menopause is a natural event that occurs in every woman's life. It's an indicator of the end of the woman's reproductive years. But in some cases, women experience early menopause. This is a common condition also known as premature menopause. Premature menopause happens when a woman stops menstruating before her natural age to do so. When you encounter menopause in your 20s or 30s, this is premature menopause. This can be an indicator that there is something wrong with your ovaries and they are not in a healthy condition. Premature menopause is known to occur in approximately 1% of women. Medical statistics revealed recently that in England as many as 110,000 women between the ages of 12 and 40 experience early or premature menopause. Premenopause. The initial symptoms of premenopause are night sweats and mood swings, although you will be experiencing normal periods. This is a time when you will notice certain changes in your behavior. The word premenopause signifies the stages in your life when you are still menstruating, but there are some indicators that menopause is not far off. Perimenopause. Perimenopause is something entirely different from premenopause. During perimenopause, women begin to notice the signs of menopause while continuing to ovulate and have menstrual periods. Many women begin to notice irregular periods and the onset of hot flashes, but may still be 3 to 5 years away from the full onset of menopause. Perimenopause is the stage when you see the first signs of menopause beginning to take place. During this stage, you will continue to have periods. There is a lot of confusion regarding premenopause and perimenopause because they are so phonetically similar. But there shouldn't be. Premenopause is what happens before menopause, and perimenopause refers to the beginning of the onset of menopause. Perimenopause describes the period when there are many significant changes in the woman's body, such as hot flushes and night sweats. Marked mood swings are common during this phase. During this phase of perimenopause, you are still fertile and reproductively active. However, the indicators are there to tell you that you are nearing menopause. This is a phase when there are fewer chances of getting pregnant. This phase is marked by a considerable rise in the level of your follicle-stimulating hormones. Menopause. When it comes to menopause, most women experience hot flushes. The time period during which the average woman experiences hot flushes ranges from 1 to 5 years. Women who have had their ovaries surgically removed generally experience more symptoms. There has been a considerable amount of research to try to discover why women have hot flushes. As a result of this research, it is believed that a sudden drop in estrogen levels make the brain release a burst of hormones. This sudden surge in hormones increases gonadotrophin levels, which has been identified as the cause of hot flushes. Women also report feeling suddenly hot or cold, with profuse sweating or cold chills at any time of the day. Menopause is also signaled by certain changes in the menstrual cycle. This can sometimes be accompanied by an increase in painful cramps. With the passage of time, menstruation ceases and the cycle stops. Postmenopause. Postmenopause is used to denote the phase of your life after menopause. Once a woman has gone 12 months without a menstrual cycle occurring, she has reached full menopause. The ovaries at this time no longer release eggs and produce much less progesterone and estrogen. Pregnancy is no longer possible at this stage. Once you recognize the signs of the onset of menopause, or you are in full menopause, then you should make the necessary changes to provide yourself with as smooth a transition as possible. If you are finding it difficult to manage the symptoms of menopause, you should seek the advice of a doctor. During perimenopause, symptoms generally occur because of constant fluctuation in hormone levels. After menopause, symptoms decline because estrogen and progesterone levels remain consistently low. This was the chapter about the stages of menopause. See you in the next chapter.